Pain in left arm causes and symptoms. Though small aches and pains are a normal part of aging, sudden or unusual left arm pain can be linked to a more serious condition. This may be a signal of an injury that needs treating, or, in the worst case, a symptom of a heart attack. Being aware of the potential causes and characteristics of left arm pain can help someone recognize what the body is reacting to and when it is necessary to seek medical attention. Heart attack. A heart attack is the death or damage of a portion of heart muscle due to a lack of oxygen. Most heart attacks happen when the coronary arteries have narrowed because of a buildup of cholesterol and fatty plaques. If a piece of plaque breaks loose from the artery wall, it can cut off the flow of oxygen-rich blood to the heart, causing a heart attack. Left arm pain is one of the most common symptoms of a heart attack. The American Heart Association advises calling 911 if sudden left arm pain worsens over the course of a few minutes or is combined with any of the following symptoms: discomfort at the center of the chest that lasts longer than a few minutes or goes away and then returns; pain, numbness, or any other unusual discomfort in the back, neck, jaw, or lower abdomen; shortness of breath with or without chest pain; indigestion, nausea or vomiting; lightheadedness; sudden cold sweats or flushing. Chest discomfort is the most common heart attack symptom in men and women. It takes the form of pressure, tightness, fullness, burning, or gradually building pain. However, women are most likely than men to experience symptoms without the typical chest or arm pain. These symptoms are often passed off as a result of a virus, indigestion, or stress. If one experiences any sudden and unaccounted for combination of nausea, vomiting, shortness of breath, or pain in the lower abdomen, back, or jaw, medical attention should be sought immediately. Angina. Angina is discomfort of pain felt when the heart is getting less oxygen than it needs. Along with left arm pain, symptoms might occur in the shoulders, neck, back, or jaw. Angina can also feel like indigestion. Angina is not a heart attack but a sign of a heart problem. Mostly it results from the coronary arteries being clogged or narrowed. There are two main forms of angina. Stable angina is predictable and manageable. It occurs only during times and physical effort or emotional stress. Then the heart is working extra hard and needs more oxygen than the narrowed arteries allow. It can be treated with rest and, if needed, an artery relaxing medication called nitroglycerin. Unstable angina is unpredictable and dangerous. It can occur even when resting, meaning that the heart is constantly not getting enough oxygen. Unstable angina is a signal that a heart attack might happen, and it must be evaluated in an emergency room. Skeletal-muscular injury. Left arm discomfort is probably not heart related if it has the following characteristics: stabbing pain that lasts only a few seconds at a time, pain brought on by movement or touch, pain that is only found on a small spot on the arm, pain that persists without other symptoms for hours or days. Instead, the discomfort could be the symptom of an injury to the bone or tissue in the arm, shoulder, or elbow. Some common skeletal-muscular conditions that might cause arm pain include bursitis. A bursa is a fluid-filled sac that acts as a cushion between a bone and its surrounding soft tissue. Bursitis occurs when the bursa becomes inflamed. Left arm pain may be a symptom of shoulder bursitis, which usually results from joint overuse. It could also be caused by direct trauma or bursa infection. Tendinitis. This is the inflammation of the connective tissue between muscle and bone. As in bursitis, tendinitis is brought on by repetitive joint use. For this reason, it is seen in tennis players, swimmers, and musicians. Tendinitis in the shoulder or elbow could be the source of left arm pain. Rotator cuff tear. The rotator cuff is a group of muscles and tendons that hold the shoulder in its socket and help with lifting and rotation. A tear in the rotator cuff's soft tissue can be very painful. It results from shoulder overuse or direct trauma. Aging is also a risk factor as it can lead to degeneration of shoulder tissues. Herniated disc. When one of the spine's cushioning discs bursts, it just out between spinal bones and pushes against the surrounding nerves. If the affected nerves serve the arm, a person may feel arm pain, numbness, or weakness that could be confused with a heart attack. A common cause of disc herniation is heavy or repetitive lifting. Fracture. Arm pain may be a symptom of an undetected broken bone. Even with a good understanding of this possible skeletal-muscular conditions, it can be hard to tell apart injury from a heart attack. Certain risk factors for injury, like age and physical activities, also overlap. For these reasons, it is important not to try to self-diagnose an injury or rule out a heart problem based on an unclear symptoms.